I'm Esther from Skylark First Aid. This is a short video to show you how to do CPR on a baby or an infant. Now, baby is in first aid terms under 1 year old, so they're literally a baby in arms. They are a small child, a small baby under 1 year old. If you're looking for child CPR, so over 1 year old, there's another video about that one if you want to find it on my YouTube channel. So a baby is usually in what we call respiratory arrest. So they stop breathing due to a respiratory issue, which is why we give them 5 rescue breaths right at the start. And it's really important that we do give this baby breaths. We must include the breaths in our CPR, as we should with children as well. With adults, it can be a bit more optional. It's up to you whether you give the breaths or not, really. It's better for the casualty if you can. But with a child and a baby, we must give those rescue breaths, otherwise it could have a really detrimental effect. So we start off with 5 rescue breaths, and we only give these once right at the start. After that, we can go on to 30 and 2, and we keep repeating that 30 and 2. So 5 rescue breaths. You need to open the baby's airway. We need to move their tongue away from the back of their throat because they're unconscious. Hand on head, finger on the chin, and just tip the baby's head back a little bit. Don't push it back too far. You only need to get their head in a neutral alignment. So you tip the head back a little way, and then you'll probably be able to cover their mouth and their nose with your mouth because they're so tiny. On this mannequin, there aren't any holes in the nose, so you'll just see me covering the mouth, but try and cover both. And when we do our 5 breaths, watch out to the corner of your eye for the chest rising and falling. And once the chest has risen, then we stop blowing. They're not like a balloon. They're not going to keep getting bigger and bigger. And we don't want to over-inflate the lungs. So it's a short breath 5 times. During the 5 breaths, keep looking at them for signs of life. Look at them for them breathing for themselves. If at the end of the 5 breaths they haven't shown any signs of life and they're not breathing properly, then we do carry on to the CPR proper. So at this point, I can't see any signs of life with this baby after I've given the 5 breaths. So I am going on to my 30 compressions. And we use 2 fingers. It's these 2 fingers. You might need to bend your middle finger. You want them the same length, ideally. And we're using the fingertips, not the front, the pads of your fingers, but the fingertips. So this can be difficult if you've got very long nails, but it's right on the edge. And we're using their nipples as a guide. Rip the clothes open if you need to, that's fine. You're putting the ends of your 2 fingers between their nipples on their sternum. So that's that flat, wide bone, your breastbone, that all the ribs join to. So there's the nipples, 2 fingers, upright. And I want the pressure to be vertical, directly downwards in the centre of their chest. I'm pressing to a level of 3 to 4 centimetres on a baby, and a quick way to establish that is to look at their depth from the floor and go down 1/3 of their depth. So it's about 3 to 4 centimetres. And the speed is exactly the same as it was with a child, and it's the same as it is with an adult. So it's quite easy to remember. 100 to 120 compressions a minute. So if you think about doing 2 per second, you'll be along the right lines. So 2 fingers in between the nipples. .30 compressions. Make sure the baby's on a solid surface when you're doing this, so it's no use carrying them as you do it or having them on your lap. The floor's the best place, to be honest. It's the safest, most solid place for them to be. So take them out of a cot, definitely, and you wouldn't put them on a sofa or a soft chair. You could put them on a table or a kitchen cupboard. It's still a solid surface, and like with a child and an adult, they need to be on the floor because you've got to get over the top of them. It's not so vital with a baby because they're smaller Just be aware if you are putting them on a raised surface that they can't roll off. I just think the floor's safe, isn't it? You know, they're not going anywhere on the floor. So 30 chest compressions, and then I'm going on to 2 rescue breaths. So I do that neutral alignment with the head, take the head back a little way, and 2 breaths. And then straight back on, find the nipples, tips of the fingers, back to my 30 compressions again, depth of 3 to 4 centimetres. And then I keep repeating 30 compressions and 2 rescue breaths until they show signs of life, or until the paramedics come and take over from me, or another first aider takes over from me, or until I'm absolutely exhausted. Try and keep going as long as you can, obviously, with no breaks in between. If you do need to go and to leave the baby to go and make the 999 phone call, obviously with a baby, we can scoop them up and run to wherever the phone is, make the phone call and start CPR with them there. So at least babies have got the added advantage of they're a bit more portable. We can actually carry them away to somewhere else if we need to, but get that CPR started as soon as we possibly can. I hope that's been some help for you. If you want to know about courses, I do paediatric courses. Have a look at my website, skylarkfirstaid.co.uk. I'm on social media, on Facebook and Instagram at Skylark First Aid. Thank you for watching.